Chapter 36. Another type of special consideration or special challenges are different sensory disabilities. They fall into a couple of different categories. The first one we'll talk about is visual impairment. Possible causes can certainly be there might be an issue with the nerves, might be an issue with the actual sensory organs there in the back of the eye, can be because of deficit within the structure of the eye itself, something that happened congenitally or from trauma, can also be from medical issues as well. The degree of visual impairment kind of ranges. It just kind of depends on why they've got the vision impairment. Some patients lose either their peripheral or their central vision or all of it. Some can distinguish light and dark. Some can discern general shapes. Some can see motion. It just kind of depends. And they may be hard to recognize. You may not have a patient that's really forthcoming with what's going on with them. So, for a patient that you know has visual impairment, make yourself known when you enter the room, introduce yourself and anybody else that's with you. It's actually better to have them introduce themselves because then the patient can identify their voices and also get a idea for where they add in the room. Your patient may need visual aids, and it might help make your patient more comfortable and more able to talk with you. So ask them if there's anything that can help them talk with you. Your patient may feel abnormally vulnerable or disoriented, especially if they're at a scene that's away from their house or their normal surroundings. It's often helpful to tell the patient what's happening, identify noises, describe situations and surroundings, especially if you have to move them from where they're at. They may be familiar with the vehicle that they're driving or riding in, but once you take them out of that, now they have nothing to familiarize themselves with what's going on around them. For transport considerations, take their cane or walker if they use them. If the patient has a service animal, try and make arrangements for that animal to travel with them. It's definitely helpful to have that dog there with them. Or they actually use horses now, like miniature horses. So, whatever animal it is, it's definitely helpful if you can keep that animal with them. Um, Try to always guide the patient, let them kind of take the steps themselves if necessary. Just light touch on the arm or elbow, let the patient rest their hand on your shoulder, on your elbow, so that they aren't being forced in one direction or the other. We're not pulling them, we're not pushing them. You can certainly ask the patient what method they prefer, and then make sure that you give them a heads up on any obstacles that could potentially be in their way. For those with hearing impairment, it might just be slight hearing loss to complete deafness. Many those in the elderly or geriatric population have some degree of hearing loss, and it actually isn't even just that. We talked about the mosquito ringtone in the previous lecture. I mean, I can't hear it. So I'm in my 30s. So I already have what's considered hearing loss at this point. You want to try and figure out what's going on with the hearing loss. It might be problems with the nerves, so it's not being transmitted up to the brain. There might be a conduction issue within the outer or inner ear, something wrong with the tympanic membrane. This may be just a temporary issue. It might not be anything long term. Some things that you might see that kind of gives you clues is presence of hearing aids, poor pronunciation of words, or failure to respond to your presence or questions. That might give you a heads up. Oftentimes with the poor pronunciation or hearing aids means that it's more of a longer term thing. Trying to communicate with somebody that has hearing impaired, locate and help them insert their hearing aids if they've got them. Make sure that you face the patient when you communicate. Try and stay within that 18-inch span right in front of the patient. Don't exaggerate your movements or look away because that's going to be harder for them to see. They're used to reading normal lip movement. Don't immediately think that what you need to do is speak louder. Actually, doing the opposite, trying to lower your pitch, might be better. Um, if possible, American Sign Language is definitely helpful. Uh, that's not something that we typically come across, but it can be really helpful in our field. You may need to provide the patient with like a paper or pencil so that they can write down their answer and try and limit it to only one person actually asking questions, because when you get too many questions going on from too many different people, it can be really hard for the patient to figure out who they're supposed to be talking to. Some people that are hearing impaired may utilize hearing aids, sorry, so that they can hear better. There's a couple of different types. There's behind the ear, conventional, in the canal, completely in the canal, uh, and then there's implantable options as well. And there's a picture on the next slide that kind of looks at some of those. The device should fit snugly. If there's this really loud screeching sound, that means it's probably not far enough in the ear, and so it'll have to be adjusted. And here's kind of a different look at some of the um, hearing aids that you might run across. Now we'll talk about some of the physical disabilities. So cerebral palsy, this is just kind of a group of disorders that are characterized by poorly controlled body symptoms. They can range from mild to severe. Um, Symptoms just truly range depending on what is affected within the patient. This cerebral palsy typically is an intrauterine or birth time injury. This is not a genetic condition. And depending on which part of the brain is affected is what their symptoms are going to show to. So you honestly can't just pin it down and say, yes, this is exactly what it is. Important considerations, make sure that you pay attention to the airway. Don't assume intellectual disability. Oftentimes those with cerebral palsy are very, very intelligent. They just have problems with motor, which can affect their speech as well. Limbs are often underdeveloped, which makes them prone to injury. They don't have really, really good muscle tone. Patients who have the ability to walk, because a lot of times this does affect their ability to walk. They may have a very unsteady gait, very prone to falls. We want to make sure that we pad the patient underneath bony prominences, particularly to try and make them more comfortable, because they don't have all of that muscle and that fat tone. They tend to get very uncomfortable very quickly because they have a lot of pressure points. And if they have a walker or wheelchair, some sort of assistive device, make sure that you take that along with them as well. Spina bifida is a birth defect that's caused by incomplete closure of the spinal column during embryonic or fetal development. And you can see a picture of it there on the screen. Your spinal cord ends up being exposed. The opening can be closed surgically, but you often end up having some sort of spinal or neurologic damage. There are a couple associated conditions. So hydrocephalus is a bunch of fluid up in the brain or up in the skull, which puts pressure on the brain. Partial or full paralysis of the lower extremities, loss of bowel and bladder control, and then oftentimes those with spina bifida have a very, very extreme latex allergy. Make sure that you involve the patient and or their caregiver on how to best move them before you actually start to transport them. Paralysis is the inability to voluntarily move one or more body parts. There's several different causes. It could be injury, it can be illness. It just kind of depends. The patient may have either normal sensation or increased sensitivity, which is called hyperesthesia. The diaphragm may not function correctly, which then requires the use of a ventilator. The patient may have specialized equipment such as urinary catheters, tracheostomy tubes, colostomy tubes, feeding tubes. They may have a lot of difficulty swallowing, which means that they can't swallow their saliva, and so oftentimes they need excessive suctioning. Again, same with spina bifida, but ask patients and or caregivers how best to move them. Another group of patients that we're going to talk about is bariatric patients. So this is a person that has an excessive amount of body fat that categorizes them as obese. This is because of an imbalance between calories consumed and calories used. Obviously, they have greater than ideal body weight, but in order to be considered obese, you have 30% or greater over ideal body weight. The causes of obesity are not fully understood. It may be attributed to low metabolic rates or some sort of genetic predisposition. Severe obesity is when someone is 2 to 3 times over their ideal weight. Quality of life definitely gets negatively affected because there are several different associated health problems. For us interacting with somebody that is dealing with obesity, consider extra resources. Patients may often be embarrassed by their condition, and when we struggle to get them where they're supposed to be, that absolutely makes it worse. So if you are knowing that you're going to transport the patient, plan early for extra help and or specialized equipment. Still treat them with dignity and respect. It's okay to ask the easiest way to move them or how they end up getting around. Don't just lift by one limb, then we end up causing injury to their joints because they are not meant to move that way. Try and coordinate and communicate all of your moves prior to lifting. In our equipment, there are places where they come together and they create pinch points. And so we want to make sure that we are paying attention to where those could potentially be, because we could end up causing some pretty significant soft tissue injuries or deep vein thrombosis. And we definitely don't want to do that. Large patients may have difficulty breathing if they're supine, so oftentimes we're going to have to figure out how to sit them up a little bit. And then notify the receiving facility early so that they can have extra resources available to them as well. Sorry. So tracheostomy tubes, the section is going to be patients with medical technology assistance. So tracheostomy tubes, you end up having a stoma, which is just an opening between the surface of the neck and the trachea itself. And then it's kept open by what you see on your screen, the tracheostomy tube. It can be either temporary or permanent, just depends on why the patient has it. Patients that have a trach often depend on home ventilators and often have chronic pulmonary medical conditions that require them to have that. Since it is not usual to have that within their airway or respiratory tract, the body ends up trying to get rid of it by building up mucus. Tubes are prone to becoming obstructed by either mucus plugs or foreign bodies. We end up using the DOPE mnemonic to determine what the possible cause of obstruction is. So it could be displacement, obstruction, could be equipment failure. So a lot of this is just going to be needing to make sure that it's where it's supposed to be and making sure that it's clear. Common problems with trachs, most of the time is just going to be that they get plugged up. Sometimes they can get dislodged. Our management is going to rely a lot on the family or the patient if they have the ability to let us know what's going on. They're very familiar with the care of that tracheostomy tube. Even if it's new, they go through extensive training. So we want to rely on them quite a bit. We'll go ahead and stop right here.